This conference will now be recorded.
Today's class is about grand multipara and elderly Primi. So coming to the, we'll discuss first about grand multipara. Coming to the definition of grand multipara, it is a pregnant mother who has got previous 4 or more viable births, then we'll call it as a grand multipara. And why is it important? Because uh, there are so many complications, and there will be increased incidence of complications during pregnancy, during labor, and also during puerperium. So coming to the complications during pregnancy, they are either spontaneous or induced abortions are more common, and inherent obstetric hazards such as malpresentation due to pendulous abdominal wall and increased pelvic inclination from lordosis. These are all complications of grand multipara. And other complications like multiple pregnancy and placenta previa, medical disorders such as anemia and hypertension. As there will be increased age also with grand multipara, there will be chances of associated complications like hypertension, diabetes. So all this will be more. And coming to the prematurity, this is also complication of grand multipara. And those with complications during labor like cord prolapse and cephalopelvic disproportion, obstructed labor, ruptured uterus, and postpartum hemorrhage, shock, all these are complications which we will encounter during labor. Coming to the cord prolapse, this is mostly due to the malpresentation and high floating head, which is common in multipara. This malpresentations, these are more common due to, and these may lead to even obstructed labor also. Coming to the cephalopelvic disproportion, this may be due to increased size of the fetus, and due to malnourished mothers, there will be some changes in the pelvis, that is secondary contracted pelvis will be seen in grand multiparas. And the other will be the rupture uterus and postpartum hemorrhage. The postpartum hemorrhage, it is mostly atonic uterus, or sometimes there may be adherent placenta due to the trauma which is caused in the previous pregnancies. So it may land up, the patient may have some adherent placenta, so PPH may occur. And the next common complication will be the ruptured uterus. If there is an obstructed labor or any obstruction of the fetus, then it may lead to the ruptured uterus. And this PPH, it may finally land up in shock, or the shock may be due to anemia, hypertension, all these conditions which are associated with the mother. The next complications, the next thing is the complications during puerperium. There will be increased morbidity to the mother due to sepsis and internatal hazards, and subinvolution may also be seen, and failing lactation. These are the most common complications in the puerperial period. So coming to the management of the grand multipara, the cases, these will be considered as high risk pregnancies, and they need adequate antenatal care and should have a compulsory mandatory hospital delivery only. And during labor, certain guidelines should be followed, like pelvic assessment should be done as a routine, and presentation and position of the fetus should be checked priorly only. And any undue delay in progress should be viewed with a concern, so that we'll prevent PPH. So this is all about grand multipara. So coming first, we discussed about the definition of the grand multipara, and then complications during pregnancy and during labor and puerperium, and then how to manage antenatally and during labor we have discussed. And the next will be the elderly Primi gravida. The next topic, elderly Primi gravida, it is defined as women having their first pregnancy at or above the age of 30 years. According to FIGO, that is Federation of Obstetrics and Gynecology India, it is around 35 years, and these are called as elderly Primi gravida. And it is based on the fact that the outcome of pregnancy is adversely affected beyond the specific age limit. So actually, the age of the mother is very important, because with increased age, it generally affects the fertility of the woman also, as beyond 32 years, there will be decline in the fertility. This may be either due to the fixed number of oocytes or any chromosomal abnormalities, or fecundability will be decreased. So all these factors affect, first it will affect fertility only, and then if she got pregnant, then it will affect the pregnancy. This elderly Primi gravida, they are classified into two groups of patients, one with high fecundity and one with a low fecundity. The one with high fecundity, it is nothing but a woman married late but conceived soon after marriage, and low fecundity means woman married early but she conceives long after marriage. That is, from marital life, it will be more. The later one is it is prognostically more unfavorable so far as the obstetric outcome is concerned after conception, and this is followed by the treatment of infertility. Next, coming to the complications of this elderly Primi, they are classified into those complications which are encountered during pregnancy and those during labor, and then the fetal risks. Coming to the complications during pregnancy, the most common complication early in the pregnancy during first trimester will encounter with abortions. These abortions, these can be either spontaneous, mostly these are spontaneous abortions. These may be due to chromosomal abnormalities like trisomic and euploidy, and this depends on the oocyte quality also. And any changes in the uterine and hormonal function may also play a role in these pregnancies, and it may land up in abortions. Sorry. And the next will be the preeclampsia. Before this, generally ectopic pregnancy will also be more in elderly Primi. This is almost with the increasing maternal age, and this may be due to the risk factors will be there will be multiple sexual partners, pelvic infection, or any tubal pathology. These all land up in an ectopic pregnancy in elderly Primis. And the next complication will be the chromosomal abnormalities. As there is increased maternal age, we already know there will be more chances of development of chromosomal abnormalities like Down syndrome, any trisomies, non-distinctional complications. All these will be seen. And next will be the preeclampsia. These complications are related to the pregnancy. As we already know, with increased age, the general medical complications like hypertension, diabetes are more. The chances will be more. So there will be more chances of preeclampsia also. And next is the abruptio placenta. The placental problems, generally abruptio placenta and placenta previa are higher among the older women, and multiparity, it implies excessive risk. Complications like uterine fibroid and post-maturity IUGR are also common as these women are having more age. Next, complications during labor. During labor, there may be more chances of preterm labor, and prolonged labor will also be seen. Maternal and fetal distress and retained placenta, these are all complications during labor. During labor, stillbirth is also more common. Almost 13 to 14 times, 14% in 1,000 risk of in over 1,000 population will have stillbirths. These are the complications of the fetus, that is the same preterm birth, prematurity, IUGR, and fetal congenital malformations. And coming to the prognosis, the maternal morbidity is high and the maternal mortality is slightly increased due to increased complications and operative interference. And the perinatal mortality is increased due to prematurity, and there will be increased congenital malformations, and operative interference will also be more in these elderly Primis. And coming to the management, preconceptional counseling should be done priorly. This is regarding infertility, like complications like infertility and options for ART, and any diagnosing medical disorders like diabetes, hypertension. These should be counseled and they should be treated previously. And we have to inquire about the family history preconceptionally only, and chances of chromosomal anomaly should be explained to the mother, and structural anomaly should also be explained. And the next will be the counseling should be given regarding the complications during pregnancy which are encountered, and complications during delivery should also be explained to the mother. And next, after preconceptional counseling, if the mother, if she has been pregnant, then we have to give her a good antenatal checkup, and the antenatal supervision is mandatory, and she should have a hospital delivery. So coming to the principles to be followed, the result of induction is unsatisfactory, and as a cesarean section is preferred alternatively. And TIFA, these are done to exclude fetal genetic and structural anomalies during her antenatal period. And development of complications like hypertension, diabetes, any other medical disorder should be viewed previously. And during antenatal period, we have to see for anomalies through ultrasound, that is nuchal translucency, and TIFA should be done. And antenatal screening with quadruple test and integrated test should also be done. So these are all, this is all about elderly Primi. If you're having any doubts, you can ask me. This is very small topic, that is elderly Primi Pravda and grand multipara. These are very small topics, and we have discussed briefly only. If you're having any doubts, you can ask me now. Is anyone having any doubts?
No, ma'am.
Okay. So I'll share the PPT with you guys. I'll share it in the group. If you have any doubts, you can ask me.
Okay, ma'am.
Yeah. Okay.